My name is Carla Rodriguez. My topic is fungal endophthalmitis. Definition: fungal endophthalmitis is a particularly serious complication that causes and significant of blindness. It typically presents in an 8 weeks later anterior inflammatory reaction with progressive appearance of fluid infiltrating in the anterior vitreous cavity interflows of strings of pairs. Mice occur as exogenous or endogenous infection.
The Centers for Disease Control and Prevention reports that while fungal eye infections are extremely rare, they can be very serious and can be caused by many different types of fungi. The following information is sourced from the CDC's website. Types of fungal eye infections. Fungal infections can affect different parts of the eye. Keratitis is an infection of the clear front layer of the eye, while endophthalmitis is an infection of the inside of the eye. Types of fungi that cause eye infections. While there are many different types of fungi that can cause eye infections, common ones include Fusarium, a fungus that lives in the environment, especially in soil and on plants; Aspergillus, a common fungus that lives in indoor and outdoor environments; and Candida, a type of yeast that normally lives on human skin and on the protective lining inside the body called the mucous membrane. Symptoms of fungal eye infections. In people who have had exposures that put them at risk for fungal eye infections, the symptoms of a fungal eye infection can appear anywhere from several days to several weeks after the fungi enter the eye. Symptoms are similar to the symptoms of other types of eye infections and can include eye pain, eye redness, blurred vision, sensitivity to light, excessive tearing, and eye discharge. Who gets fungal eye infections? Anyone can get a fungal eye infection, but these infections usually are linked to one of these situations: eye injury, particularly with plant material; eye surgery; chronic eye disease involving the surface of the eye; wearing contact lenses; exposure to contaminated medical products that come in contact with the eye; and fungal bloodstream infections. These are just a few highlights of the wealth of information the CDC provides about fungal eye infections and the fungi that can cause.
Application in nursing. Assess the above-mentioned 6 and 6 tone present with the patient's redness of the conjunctiva, decreased vision, angelic edema, pains. At the same time, we must relax the sex that agrees to provide with the patient about factors that may have delayed this communication. Such are previous surgical intervention. If the secretion is abundant and ocular lavage is performed, it is convenient before the elimination of secretions and to maintain the maximum access possible. Pros: fungal endophthalmitis, when diagnosed in time, can prevent many of the complications that is instant and apply the appropriate treatment. Cons: the characteristic ophthalmology since is the presence of a wide elevated polydermarky lesion involving the shoulder and retina located in the posterior port which may be single or multiple and is not treated in time the damage is irreversible.
Hi, I'm Robert Morris, president of the Helen Keller Foundation, and this is Helen Keller. I'm also a co-author of the report in Clinical Ophthalmology in June 2020 on treatment of post-cataract endophthalmitis. All patients were treated at Retina Specialists of Alabama and the UAB Callahan Eye Hospital in Birmingham, Alabama, USA. If you perform cataract extraction and your day 1 2020 patient presents on day 2 with only hand motion vision and obvious endophthalmitis, you want immediate and optimal treatment to restore your patient's vision. If you're a retina specialist, how would you like to restore 20/40 vision in almost 80% of such patients instead of little more than half? And worst case, if your patient has only light perception vision, how would you like to restore 20/40 vision in 55% instead of 33%? We accomplished this by doing complete vitrectomy as soon as possible whenever the retina was obscured by pus, and by intense postoperative treatment for 2 to 3 days until the eye stayed clear and the infection was definitively cured. Endophthalmitis retinopathy, uncovered by vitrectomy, causes most vision loss. Antibiotics alone are usually not enough to halt ongoing damage. A sterile, non-toxic vitreous cavity must be restored and maintained. Here we review 10 years of endophthalmitis treatment using such an approach, made possible by small gauge vitrectomy technology. We believe that eyes with profound visual loss from fundus obscuring endophthalmitis are best treated by complete and early vitrectomy, or sieve, and that tap inject should be considered only for early cases with a preserved view to the fundus and count fingers or better presenting vision. Please contact us if you have further questions after reading this article. Be sure to view the important images and videos.
Issues appeared in Ecuador. Currently is given used as first-line treatment is fungal endophthalmitis, debris is local and systemic toxicity. The emergence of oral antifungiacids with lower rates of side effects and the possibility of oral administration has been presented as an alternative. Some cases are being described as the therapeutic use of both coincident in patients with fungal endophthalmitis. Fungal endophthalmitis is usually an indolent bilateral infection in one-fourth of cases, and the most common symptoms are blurred vision and photophobia. Conclusion: fungal endophthalmitis is a particularly serious ophthalmologic emergency and requires prompt initial attention due to the consequences it may entail. The work of the nurse hardware in the communication with the rest of the team is extraordinarily significant boost in the management of the physical and psychological symptoms of the patient and his or the family. Thank you.